Good afternoon, everybody. This is Chase Howard of the Florida Healthcare Law Firm. I'm just going to give it maybe 2 or 3 more minutes for some people to jump in here. Otherwise, this broadcast, this webinar is going to be recorded. After a few days, we will get it posted on our website. We'll send out some notifications, emails, so everybody who didn't get a chance to attend live can attend it. So I'll give it a few minutes, and then we'll jump into this. Okay, let's get started. So again, my name is Chase Howard. I'm an attorney here at the Florida Healthcare Law Firm. We're based in Delray Beach, Florida, and we work with healthcare professionals and healthcare businesses of all types, sizes, throughout Florida and nationally on certain matters. We are a transactional and regulatory law firm, so we advise clients on the regulatory landscape, the healthcare laws of Florida and on a federal level, and a business corporate transactional law firm as well. So we do quite a bit. My focus is on a number of things, but one area that I really like to dive into are what I call the non-traditional healthcare businesses. So not a traditional physician practice or dental practice, but where mid-level providers or other licensees are opening a healthcare or medical business and providing typically cash pay only services, so no insurance is involved. Over the years, and especially the last few months, we've had an uptick in changes in regards to supervision for different providers. So I just wanted to dive into that today, go over some various licensees and their scope of practice and supervision requirements, what they can and can't do, and then talk a little bit about what we were hoping to have with a update to Florida prescribing law for controlled substances. But I'll update you on that, and we'll go from there. So I get calls all the time and clients and prospects that are always asking me, I'm this, I have this license, or I'm opening a medical spa or aesthetic center or clinic, and I want to hire this person with this license, and here are the services I want to do, but I don't know if I can do them. What's legal and what's not? So first and foremost, this medical spa world, the aesthetic clinic, whether it's a full service providing dozens of services or just one specific service, there's a lot of gray areas still. There's not one set of rules or laws. There's not one regulating body. There's not one guidebook we look to give the guidance that we do. So what we have to do is really look at each individual board and body and piece together from there based on, statute definitions of what for example, cosmetologist can do and offer versus what a nurse practitioner can do and offer, and the types of supervision they need. So over really since last March, Florida passed autonomous practice in a limited sense for nurse practitioners. That went into effect July 1st, and then we got some application and guidance sometime in late October, November. And the Board of Nursing has quietly updated definitions since that time, but still it's limited. And then in March, or in April actually, we got word from the Electrolysis Council and the Board of Medicine that supervision for electrologists performing laser hair removal in Florida was going to be updated. So those are kind of the two big changes. But I figured it'd be good to have a rundown of some common licensees and providers that we have questions for. Go through that. So I'll be going through that. There's a chat option. If you have any questions that come up, feel free to put them in there. I'll probably try to answer them at the end, or we'll put out an asked and answered memo after this, so we don't drag this on too long. So nurse practitioners, I'll start there first. Like I said, last March, Florida passed autonomous practice for nurse practitioners. The Board of Nursing limited that practice, or at least the statute limited that practice to really primary care practice. And according to the Board of Nursing, primary care practice includes physical and mental health promotion, assessment, evaluation, disease prevention, health maintenance, counseling, patient education, diagnosis and treatment of acute and chronic illness, and this includes behavioral and mental health conditions. The board goes a step further to say that nurse practitioners cannot perform surgical procedures other than subcutaneous procedures under the autonomous license. And then, the last thing they say, and this has to do with supervision, is once you become autonomous, or you apply and you're approved, and you're providing services in the primary care space, that completely removes the requirement for any sort of supervision by a physician or a protocol with a physician as it pertains to that. So, there's questions about, well, are cosmetic procedures included? And I think that's a tricky question. I think it's still quite a bit of gray area. I think that there's risk involved with a autonomous nurse practitioner providing cosmetic services and procedures. So, I think if there's an opportunity for sort of a hybrid supervision model with a supervising physician and nurse practitioner, a nurse practitioner might be providing primary care services or even, hormone therapy services, but the cosmetic and aesthetic services they're going to provide should be supervised by a physician. And in getting into supervision of a nurse practitioner, and we'll loop physician assistants into this as well, but getting into supervision of a nurse practitioner and physician assistant in the cosmetic aesthetic world, there are some more specific requirements as to who or what type of physician can be the supervising physician. So if the nurse practitioner or PA is at a location other than the primary practice location of the supervising physician, and that nurse practitioner or physician assistant is performing primarily dermatologic or aesthetic skincare services, then the physician must be either board certified or eligible in dermatology or plastic surgery, and they must be within 25 miles of the physician's primary practice location, but up to 75 miles if it's in a contiguous county. So there's a little bit of leeway there. And then in addition, the physician is only limited to supervision of one additional location. So there are some restrictions there. Now, when the nurse practitioner or physician assistant is providing services at the same location of their supervisor, then the restriction is actually, much more easy to work with and lifted, and there is no specialty requirement for that. So if you're a nurse practitioner or a physician assistant and you're working in the practice of a physician who's, let's say, family practice or internal medicine, and they want to offer cosmetic services, so injectables, lasers, etc., they can supervise you in that same location, and you can provide those services. Obviously, there needs to be a level of training and experience there, and there's a number of courses and trainers out there to educate both the supervising physician and the actual hands-on provider, the nurse practitioner or the physician assistant, on how to perform those services. So generally, that's how that goes. I'm going to continue to go through this list, and then I'm going to kind of go through some common services in these non-traditional healthcare practices, so we can say who can do what, or it's not really clear otherwise. Electrologists, like I mentioned, in April, earlier in the year actually, that we caught wind of some changes to the rules, where originally a physician who was supervising an electrologist had to provide direct supervision to an electrologist that's performing laser hair removal, whether through laser or intense pulse light devices. That's obviously a cumbersome requirement, because a physician to be providing direct supervision arguably means in the room, but at the very least it's meaning in the same practice location and available upon a call to come running over and treat the patient if something occurred. So in January, we got word that the council and the Board of Medicine were working on a rule change, probably to make such requirements a little bit easier to work with in light of COVID-19 restrictions and safety. And so what the rule change essentially did was it created an opportunity for physicians to provide remote supervision through telehealth means. And so what the new rule allows for is basically an electrologist can now perform laser hair removal via telehealth or on-site physician supervision, but via telehealth is the new change. And so that's two-way audio video supervision. So via telehealth, the physician has to be within 150 miles of the electrologist, and the physician cannot supervise more than 4 electrologists at one time. So this went into effect in early April. There hasn't been really any updates since that time. If we're thinking about what the old supervision statute required, that meant definitely in person, on site. Like I said, at the very least, it meant just down the hall and available if called upon. And so until we have a little bit more guidance from the Electrologists Council or somebody asked the question, does that mean that the physician has to be on the phone, two-way audio video the entire time for the entire service, or just available or alerted at least when service starts and service finishes, or available just during the service in case something occurs? It's not really clear. I'm sure there's some risk to doing it that way versus having them on the entire time. So if we really read the new change in the rule in plain language, it certainly means they've got to be available at all times. But there's probably a little bit of leeway there, and we're going to hope that there's a little bit more guidance in the near future. Electrologists will still need to submit protocols and have protocols in place with the physician, even if they are being supervised via telehealth. Other than that, nothing else will need to be submitted to either the board or the council. Jumping over to now some different licensees. So these might not be as common, but in the medical spa world, they're definitely becoming more common. Cosmetologist license, full specialist license. and tattoo artist. Each of these licensees is governed by the Department of Health, and they have their own set of rules and guidelines. The cosmetology board really puts out great information on their website and their FAQ section. But just to kind of dive into a little bit about what they can and can't do, what I like to look at is their definition, right? So cosmetologists are a person who's licensed to perform either the mechanical or chemical treatment of the head, face, or scalp for aesthetic rather than medical purposes. And this includes some of the things you would think of: hair shampoo, hair cutting, etc. But it also gives them a little bit more leeway into things like some other aesthetic services. For example, like microdermabrasion or even microneedling. And the board actually gives some good guidance as to where the limit is for what they can and can't do. So microneedling, for example, they can perform aesthetic only microneedling, so nothing too deep. They can perform chemical peels, that's by definition. They can perform microdermabrasion as long as it's on the head, face, or scalp, and it's for aesthetic purposes only. I get questions about lasers and cosmetologists, and based on the statute and reading that, again, cosmetologists can perform mechanical or chemical treatment. There's nothing in there that says electrical, which in my mind, that's where lasers would fall under. And so for that reason, even though there's not a strict prohibition on it or anything to say that cosmetologists or full specialists could use lasers, I think the definition is clear enough that it doesn't include electrical treatments. And for that reason, even if it is for aesthetic purposes only, they probably couldn't do that, whether it's, again, medical or aesthetic. Now, if they wanted to perform, hair removal without lasers, so wax, obviously they could do that because that's, chemical, it's not electrical. Tattoo artists, this comes up in some questions, when somebody's providing tattoo removal, maybe through lasers. And if you look at the tattoo definition, there certainly is quite a bit there, but I don't know that it rises to the level of using lasers for removal. And in fact, the definition doesn't even include removal by one means or another. So, tattooing really means, piercing the skin, engraving a pigment or a dye. And even though removal of the tattoo is probably more aesthetic than medical, it really doesn't determine whether or not the tattoo artist can perform that. The definition is pretty clear that it's providing, ink under the skin, and not any sort of removal in any way. And I also get the question of, well, can tattoo artists perform microneedling because it's needles? And the answer to that is pretty much no, because it's outside of the scope of what they're doing. That's not what microneedling is. Microneedling is not piercing and ingraining a pigment, dye, or ink in the skin. It's for cosmetic or medical purposes. So that's kind of a recap on that. To touch on supervision of cosmetologists and tattoo artists, they don't need any sort of supervision. They have their license, they have their limited scope of practice, and they have facility license requirements if they're working both on their own and with a full-scale medical spa. Some specific services, I just wanted to go through some things and kind of say who can do what with what type of supervision. So injectables, what's clear is nurse practitioners and physician assistants can provide off-site and indirect. They can provide services via off-site and indirect supervision. obviously, physicians, MD/DOs can provide, injectable services without any supervision. And then, like I said, depending upon the location, there's additional supervision requirements for nurse practitioners and physician assistants as they're supervised by MDs or DOs. Lasers, really the only guidance we have on laser supervision is in regards to electrologists, which is for laser hair removal. So that's lasers and intense pulse light. Nurse practitioners, PAs, those are, again, off-site indirect supervision to fire lasers, really just going to require training and protocols with their supervising physician. If a physician wants to be on site, that's certainly fine, but it's not required. And then I also had a question once about chiropractors, and I don't work with a lot of chiropractors, but chiropractors in Florida certainly can use certain lasers that are within the scope of their practice, but that doesn't include aesthetics or cosmetics. So chiropractors, supervising nurse practitioners, and physician assistants is out of the question as well. Microneedling, I mentioned with cosmetologists and full specialists, they are allowed to use mechanical means to treat the face, head, and scalp, but it has to be for aesthetic purposes only. I don't know that there's a agreed upon depth for aesthetical versus medical, but the less depth is probably more aesthetic, and the deeper you go, you run into medical. Once you get into medical depths, then cosmetologists and full specialists, whether they have any sort of supervision or not, can't perform anything medical. That would be reserved for nurse practitioners, physician assistants with off-site indirect supervision, or physicians, MDs, and DOs. And then lastly, hormone therapy. So I mentioned earlier in this webinar that we were awaiting some what we hoped would be some new and exciting news in the state of Florida. A new bill was really close to getting passed, and what that was going to do was it was basically going to make certain controlled substances, namely hormones, testosterone, able to be prescribed in Florida via telehealth, meaning there was not going to be the need for a in-person visit prior to prescribing, which really would have opened the door for autonomous nurse practitioners, also nurse practitioners that are being supervised at a remote location, and same thing with physician assistants, both in office and at a remote location. It was going to really open up the door for them to, in maybe a hormone replacement therapy clinic, to provide such services. That bill unfortunately reached the closing day of the session for the state legislature, and is unfortunately, as we say, has now died, and probably won't be picked up in any sort of special sessions. During COVID, we've had some restrictions lifted. In Florida, those are all, I think, running out in about 60 days or July 1st, something like that. But under the DEA, which is federal and which really is governing controlled substances, that restriction is lifted through the end of the year by executive action and public health emergency. And what that's saying is that licensed practitioners with their DEA numbers may prescribe Schedule 2 through 5 controlled substances via two-way audio-video telecommunications. So there's still opportunity there for practitioners who are doing it that way. Again, I think we're getting close in Florida to have it match that, and then maybe on a federal level, the DEA will continue this as well, and keep the door open for patient access. So that's really kind of the updates and a little rundown of certain services. Like I said, we'll be recording this and posting it, so feel free to check in later. And if you didn't watch this live, replay it. I don't see any questions here, but if there are any questions that I do actually see a couple questions here. Let me see if I can get to them. can an LPN or medical assistant perform class 4 laser treatments with an NP supervising? So the nurse practitioner autonomous practice law did not provide any sort of guidance or permission or prohibition even on nurse practitioners that are autonomous supervising LPNs or medical assistants. In general, even before that, medical assistants couldn't be supervised by NPs, but LPNs probably could. Now, does that mean they can perform class 4 laser treatments? I don't know the answer to that. I don't know that that's permitted. I think if it was a physician, you could make the argument that LPN is with direct in-room supervision and guidance. The LPN is acting as the hands of the physician. The same might be able to be said for nurse practitioners, but again, there's no support one way or another, so you have a little bit of a risk there. And let me see if there are any others here. Okay, that was the only question I see here, and nothing in the chat. So if you have any questions, this is my contact information. Feel free to shoot me an email with any questions you might have, or things you'd like to get answered. I'll certainly answer them, and we may even do a blog post, or I'll do a video check-in. If you head to our website, there's tons of free content, blogs, other webinars, checklists and items, things like that, that you can get, reference, and use. In fact, I'll be updating a supervision chart that we created last year with some of the new rules, with a lot of what I talked about. That'll be available on the website as well. And then usually weekly, I have some sort of video check-in that goes on our LinkedIn, that goes on our Instagram, and we'll update you on new laws, on little tidbits, on hot items that are going on. So that's Florida Healthcare Law Firm is our Instagram, but check out our website. We have everything there. Otherwise, thank you all for spending the last half hour or so with me and listening here. I appreciate it. We're always happy to do these things. We've got a ton of new webinars coming up over the next few weeks, and content coming your way. So always check in. And like I said, if you have any questions, feel free to reach out. We're happy to help you out.